Hello and welcome to Health Professional Radio. I'm your host, Neil Howard. Thank you so much for returning. We'll be speaking with Dr. Rebecca Etz, co-director of the Larry A. Green Center. She's joining us to discuss the alarming findings from a survey. The survey was a collaboration between LGC and the Primary Care Collaborative. They received nearly 1,000 responses from primary care professionals across the country. Welcome to Health Professional Radio, Dr. Etz. Thank you so much for joining us.
Oh, thank you, Neil. It's a pleasure to be here.
Now, I understand that you're a cultural anthropologist. Give us a brief introduction into what it is that you do and why you do it.
Sure. I am a professor of family medicine and population health at Virginia Commonwealth University. And I initially wanted to be a family doc. I was going to cure the common cold and take apple pie for my trouble. And the more I learned about the field, it was during the rise of the HMOs, they were so unhappy that I became unhappy. And I ended up following anthropology instead. I later, after receiving my degree, realized that I could use my second love, anthropology, to cure my first. So most of my work is about how do I make the pursuit of health more humane, both for the people who seek it and for the people who deliver that care.
What is it about the healthcare system that lacks humanity?
It's become very depersonalized and fragmented. Mm-hmm. So patients often feel they need to put on a suit of armor when they go to see the doctor, and their experience is assembly line feeling. It's rushed, it's one in a line, it's get through and follow your pathway, and it is very transactional. Primary care at its heart is actually a relational function of the healthcare system. It's when you find a person who is worthy of your trust, in front of whom you can feel safe being vulnerable, and you can talk about your needs, whether those needs be everyday preventive care or whether they be sensitive conversations about terminal conditions. Every person walking the surface of this country has the right to a personal doctor. Our healthcare system does not currently afford them that ability.
Is this something that's lacking in medical training? I mean, we're learning how to heal people, yet not how to deal with people?
That's a great question. I think that medical training actually does a pretty good job. The frustration, and you hear the term a lot, moral injury. Moral injury is different from burnout. It's not something that lives in a person and is one person's fault, but it is a product of a systemic environment that has issues. The moral injury that we often find is that people are trained, particularly in primary care, to take care of those who seek their help. But the system that they enter once they have been graduated and become professionals does not allow them to take care of people in the way that they were trained. There are many obstacles created by payers. There are many obstacles created by health systems and health plans that prevent the kind of care to which we aspire.
I do remember getting training in a certain area, and then once I was hired, they said, forget everything that you were trained. Here's what's going to happen. Is that what's going on in the medical field? It seems like there'd be a lot of disillusion on the part of graduates and interns.
Yes, there's a great deal of disillusionment, and it's really very difficult because we set up our programs to be the best that they can possibly be. And we say, train these people for the kind of care we want to deliver in the U.S. and the kind of care to which people are deserve. And instead, we release them into an environment that robs them of much of their decision-making, that robs them of the ability to find out from the patient's perspective what's most important about why they're there. And instead, we are led through a series of logarithms and flow charts and check boxes of what others have created as guidelines that must be covered in a visit. So half the visit that you have is not actually directed by the clinician or by the patient, but is directed by some third party about the things that they feel most important. So it's very difficult. It's like when you enter a conversation and you can't ever talk about the thing you came to talk about, and this is your one shot, you know?
So it seems to me that the concept of primary care shifts from stakeholder to patient to physician to insurance company.
It really does. From the patient's perspective, primary care is the front door to the health system. They are usually, not always, but usually your first location of contact, and they are the people who help you throughout your health narrative. So, you know, if you're somebody who has issues, if you're unfortunate enough that you have things that you need assistance with, primary care is meant not just to help you with the things that they know how to help you with, but when you have a more severe condition and you need some specialist support, when you go to the specialist, often the information that they give you is either difficult to discern, or if not difficult to discern by itself, it certainly is difficult to place it within the larger health narrative that you have. They treat you for the one condition, but they are not aware of all the conditions that you have or all the requirements that you have. And primary care coordinates that stuff for you. So without that ability, it becomes extraordinarily difficult.
Now, you collaborated with the Primary Care Collaborative. Talk about this survey where you received nearly 1,000 responses from primary care professionals. What are they saying, and what are they saying is the solution to these problems?
Sure. Sadly, even though primary care handles more than 50% of all office visits in the country, and it does that with a third of the workforce, it only gets about 5% of the national health expenditure. So again, more than 50% of the work, a third of the workforce, and only about 5% of the health expenditure. That makes it very difficult for them to function. In addition, there is no national office for primary care. There is no federal coordination for primary care. It makes it hard for them to work as a group towards change. We knew that that was the case when the pandemic was coming on. We knew before the pandemic arrived on our shores that primary care handled literally 99% of all respiratory illnesses, and this was a novel respiratory virus. This was going to hit our field and hit it hard, and nobody would know how or how to help it or how to respond. So we launched this survey so that we could hear from the front lines what it was that they were experiencing and how we could best support them. We did it weekly in the beginning of the pandemic, and then we did it monthly. And we received over 33,000 surveys from frontline clinicians. The latest one, the one that you're referring to, was our special anniversary survey. We did it on the 3rd anniversary of the declaration of the public health emergency. And it was really sad, Neil, because it showed that while the rest of the country would love to leave the pandemic behind, it still continues to haunt our healthcare clinicians and our patients. We have a tremendous buildup of health burden, things that weren't seen during the pandemic, things that weren't taken care of, offices that are less than fully staffed and yet overflowing with patient need are really feeling the pinch. So they're suffering a great deal. When we surveyed them, less than 1% said that primary care needed no support. And if anybody out there who's there, just survey your dining room table. To get 99% of people to agree on anything can be really difficult. So if you can do a national survey across the country and 99% of them agree, this is bad, then you got to believe them.
It's my understanding that you have 3 main lines of focus, bridging the gap between the business of medicine and the lived experience of the human condition, making visible the principles upon which primary care is based, and exposing the, unintended consequences of policy and transformation efforts. Are there concepts and principles that guide policy and procedure, or is it pretty much play the hand you're dealt?
Sure. There are absolutely concepts that guide us. First and foremost is that primary care is your first point of contact with the health system. It is meant to provide you with comprehensive, continuous care through longitudinal relationships, and it is meant to provide a single source that can integrate your health narrative through all the different specialists with whom you engage. That means that all of our policy is about how do we support this primary importance within our health system.
Could you give us a website where our listeners can learn more?
Our website is www.green-center.org. And if you're interested in the survey, we have a menu that's called COVID. If you're interested in some of the measures work, we try to change how quality measurement is done in the U.S. You can see that in our measures menu. And of course, there's a menu there where you can learn about our team.
Becca, it's been a pleasure speaking with you. And as I've said, I'm looking forward to our next conversation. Thank you so much for your time this morning.
Oh, thank you, Neil. It's a pleasure.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Rebecca Etz. Audio copies of this program are available at healthprofessionalradio.com.au, also at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.